Turner syndrome
by Simon Day and
Robert Sager.
Turner syndrome is a genetic disorder due to chromosomal abnormality in which all or part of one of the X chromosomes is missing or altered, resulting in a karyotype formula of 45XO. While most people have 46 chromosomes, people with Turner syndrome usually only have 45. The chromosomal abnormality may be present in just some cells, in which case it is known as Turner syndrome with mosaicism. In these cases, the symptoms are less severe or do not show.
Causes and risk factors. Turner syndrome is caused by non-disjunction, an imperfect cell division in human gametes during meiosis 1 or 2. This occurs during end phase of meiosis when the sex chromosomes are unable to separate to opposite poles of the cell. When the gamete with no sex chromosomes fertilizes a normal gamete, the final product is an XO or YO chromosome. However, YO is not viable.
Incidence and prevalence. The syndrome only affects women, and the ratio of newborns remains unchanged no matter where in the world. The incidence of Turner syndrome is 392 per 100,000 fetuses. However, more than half of these result in a miscarriage. The prevalence at birth is 50 per 100,000 female babies. Although a female is born with the syndrome, diagnosis is usually delayed by approximately 10 years.
Characteristics and symptoms. There are a good number of characteristics and symptoms that can indicate that Turner syndrome is present. In babies, small size, extra skin folds, bloated hands and feet. In children and adolescents, small size continues. Hearing problems may arise, menstruation does not begin at expected age, and breasts hardly develop or don't at all. In adults, women do not menstruate regularly, usually have fertility issues, and small size continues. As well as the characteristics mentioned previously, women with the disorder may have heart problems, high blood pressure, diabetes, eye problems, drooping eyelids, neck webbing, broad chest, overweight, osteoporosis, and social skill difficulty. And of course, a missing X chromosome.
Method of diagnosis. The diagnosis of Turner syndrome is based on physical signs that was mentioned previously and by genetic testing. In this process, a sample of amniotic fluid is taken to assess the genetic material. The emerging genetic map is known as a karyotype, and this method can be used to diagnose a number of other non-disjunction disorders. A blood sample or a different tissue sample is often enough to create a karyotype and determine whether a woman has Turner syndrome or not. Females can be diagnosed at any age, and the average age of diagnosis is actually around 10 years old. The karyotype is the most common and by far the most effective. Here's a karyotype of a woman with Turner syndrome. As you can see on the bottom right, there is no Y chromosome, only an X.
Therapy. Turner syndrome itself cannot be treated or cured. However, health problems that are a byproduct of Turner syndrome can be treated. For example, patients with heart conditions often see a cardiologist for their heart problems. Women with Turner syndrome may also be put on growth hormones to boost growing. The development of in vitro fertilization, a process by which an egg is fertilized outside of the body, has given women with Turner syndrome a possible way to start a family. As well as estrogen therapy can be administered by an obstetrician so that Turner syndrome patients are able to undergo puberty. Estrogen therapy is usually done on Turner syndrome patients until the normal menopause age. Although it cannot be cured, treatment for the side effects of Turner syndrome are available from the proper specialist.
Prevention. At the moment, there is no 100% effective way of preventing Turner syndrome. This disorder is a random occurrence and it is not inherited.
Related career. For our related career, we chose developmental pediatrician. A developmental pediatrician assesses, advises, and are able to administer treatment for patients and the families of people with a broad range of developmental disorders or difficulties, which would include Turner syndrome. The training involved in becoming a developmental pediatrician includes 4 years of college, 4 years of med school, and 3 years of general pediatric training. A developmental pediatrician mainly works in hospitals, clinics, community centers, or rehab centers. They often work with a team of other professionals to diagnose and help treat the disorder.
Famous scientist. Henry H. Turner was the discoverer of Turner syndrome, and it is named after him. He spent his career studying endocrinology, the study of hormone-related diseases. In 1938, he published and presented his findings of the syndrome at the Annual Study of Internal Secretions Association. He received his undergrad at St. Louis University, then entered the School of Medicine of St. Louis University, for which he spent 2 years at and went to complete his medical doctoral at Louisville. While his most important discovery was Turner syndrome, he is also a pioneer in endocrinology and is a very well-known figure in that field.
And that's the end of our presentation on Turner syndrome.
Thanks for watching.